Welcome everybody that's joining us at the moment. We're just going to wait a moment to let everyone into the webinar and then we'll begin. Well, we're dead on 7:30. I think we'll begin. There may be a few people still joining us. This is our 6th webinar in our series this year, and we thought we would focus on a topic that we get asked about all the time, don't we?
We do.
Diabetes research. As you know, we're a research charity, and one of the questions we get asked many, many times is, how can I get involved in diabetes research? And this is something that's different across the country. This evening, we're joined by Bernie Stribling and Gail Melvin from the Leicester Diabetes Centre, who are going to take us on a bit of a journey about diabetes research and its history, key moments, and that big question of how you can get involved. So for now, we'll do a little housekeeping. We can't see you, but you can see us. We've kept all the cameras off and your microphone's muted. You can ask questions in the chat function, and Sarah and I will keep an eye on those and we'll put them to our speakers at the end of the webinar. We've got some time allocated for those, and we've got a special video to show you at the end to close the webinar as well. Just so you know, the webinar is being recorded this evening, and we'll be able to show that for you on our UTD Digital Hub afterwards with supporting resources. And of course, we'll get in touch by email, and if there's any other questions you have, you can just let us know. Okay, shall we introduce our speakers? Okay. As I mentioned, we have Bernie Stribling and Gail Melvin from the Leicester Diabetes Centre. We've been really lucky to work with the team there for many years, and one thing they excel in is diabetes research, and that's why we've invited them along this evening to take you on this journey and enlighten you into how you can do that with them and their team. So Sarah and I will, in fact, we didn't introduce ourselves, did we? My name's Lee. I'm the event coordinator here at Diabetes Research and Wellness Foundation. I've been here for about 19 years, and I organise all our educational events for people living with diabetes, and that's all types of diabetes. And I work with the NHS teams to put on a variety of events to teach people how to manage their diabetes and the condition.
And I'm Sarah Brown, and I'm the research administrator for DRWF. I put out the funding calls for our fellowships and our small project grants, which are our pump priming grants. And I also work with our colleagues in Sweden, Finland and Norway doing the same thing. So I look after our researchers once they get funded and look at their journey from when we start to fund them and their projects, and just follow them throughout their careers. So it's always good to see what they're up to many years down the line.
Excellent. So Sarah and I will pop off the screen now. We'll hand over to Bernie and to Gail. We're still here in the background. We'll be looking at your questions, ready for the Q&A at the end, and we will see you shortly.
Wonderful. Thank you, Lee, and thank you, Sarah, and thank you to the Diabetes Research Wellness Foundation for this opportunity. As Lee's just said, I'm Bernie Stribling. I'm an Assistant Director based at the Leicester Diabetes Centre, and I'm here tonight with Gail. Gail, I didn't know if you just wanted to briefly say a tiny little bit about you.
Good evening, everyone. Thanks for inviting us here today. So I'm Gail Melvin. I'm the Research Business Manager at the Leicester Diabetes Centre. I specifically support our commercial research portfolio. I've worked in research my entire career, which, as you can tell by the grey hair, is a very long time. I used to work in the pharmaceutical industry, and then I moved to work in the NHS.
Gail moved to the other side, in reverse, I think is what it's called. So I'm a nurse by background, but I have worked in various roles within the NHS and external to the NHS, both nationally and locally. But tonight we're here to talk about the Leicester Diabetes Centre and, more importantly, why you should become involved in research. Gail, you're my slide clicker, so we're going to be doing this dual act of next slide, please.
Can I just check that you can actually see the slides, okay?
Yes, we can see the first slide and we're waiting. Yes, perfect. So the Leicester Diabetes Centre, and the photograph on the right of people's screen is part of our new extension that we're currently completing. So the Leicester Diabetes Centre is quite unique. Obviously, we're based in Leicester. We're based at the Leicester General site, if people know Leicestershire. But it's quite unique in that it's an NHS organisation, but it's linked with the University of Leicester, meaning it gives an academic rigour to the work we do. We do an enormous amount of research there, which is why we're here tonight talking about why people should become involved in research. And we host quite a number of organisations. Within the NHS, we're really good for our 3-letter and 4-letter acronyms, and tonight is no exception. We think that we host the NIHR, which is the National Institute of Health and Social Care Research, which essentially is the funding body to the NHS for research. But we host their biomedical research centres. So these were set up quite a number of years ago now. And that was about bringing research teams together, because again, I think the NHS and the NIHR recognised that people, if you collectively bring people with a common interest together, then they can pursue research interests at a much faster pace. And I think that's probably part of the rationale why we are so successful in terms of what we do. We also host the Commercial Research Delivery Centre, and this is a fairly new part of the organisation, and this covers both Leicester, Leicestershire and Northamptonshire. And I know, Gail, you'll be talking about that, because Gail is our business manager for that, along with a load of other hats she wears. We're also a host to the Centre for Ethnic Health Research. And I think it's fair to say that if we recognise the value of research, we also recognising that there are cultural differences in life, but also in research. And this is what we do within the centre, is we understand that, so we're then able to produce research that's relevant to the people it's treating. We're the home of the Desmond programme. So the Desmond programme, obviously, for people living with type 2 diabetes, they will know that it's a structured education programme, which has now been running more than, I think it's about 24 years at this point. We're the home to that. So this is for people at risk or living with type 2 diabetes. And again, in terms of research activity, that's still the only programme which has undergone a randomised control trial. And this is perhaps the top evidence base for bringing something new to the market. So if I was bringing new paracetamol to the market, I would have to undergo a randomised control trial to think actually what I'm delivering is exactly what I said I was going to do. We also host Eden, which is effective diabetes education now, and that's about training our healthcare professionals. Because I think it's fair to say that people living with diabetes live with the condition, but we also need competent and confident healthcare professionals to, I think, progress that journey. Tonight, this is our next slide, Gail, we're going to be talking about, I'm hoping that this moves on. It's not moving on, Gail. We're having the best. I love it when technology works and when it doesn't work. Aha, you see, it does work. Perfect. So tonight, what are we going to talk about? We're going to be talking a little bit of the history of diabetes treatments. And this is why You have keyboards, so please interact with this one, I think, because again, for people living with diabetes, it's really important that we understand the history, where things have come from, and what those treatments now mean to people. I think the vital role of research, why participating in research is just so important, because without people participating, we cannot conduct the studies that we really want to do. Gail's going to talk a lot about the safeguards in research and what research participation actually involves. This thing called public involvement versus participation, what's the difference in those? And then we're going to be talking a lot about the studies we have open and available and how you can get involved and participate in those. We've got one towards the end, which is a questionnaire study. And again, I think we'd like to invite everybody who's part of tonight's audience to link with the QR code on that, and let's get your thoughts and involved in research. Okay, let's go back to the beginning, to more than 100 years ago, when we had the discovery of insulin. So insulin went from a life-saving treatment into a life-enhancing treatment. But it was way back in 1922 that we had the first injection of an animal extract that we now refer to as insulin, but it had very little effect. And it's only when it started to be purified that it actually then had the desired effect, which was people stopped really losing weight and started to live and get better. So it went from life-saving way back in the 1920s to life-enhancing. And if we look at that overall journey of insulin, which is our next slide, Gail, then we moved from animal-based insulin into synthetic versions of insulin. And in the 1970s, we had the worldwide demand for insulin was projected to exceed the natural resources by the year 2000, in which case all this synthetic insulin came into place. And if we look even before this, we had glass-based syringes for people living with diabetes. We had needles that people were boiling. And if you think now what's happened around the whole technology influence in diabetes, which is our next slide, then that really changes the trajectory of it. Because if you think we had way back in the 1920s the discovery of insulin, the first insulin pump in the 1960s was this huge thing. And if you now look at the technology with hybrid closed loop and with tiny sensors, it's just incredible how things have moved in that period of time. But they've moved through research, and it's only by us understanding that we're then able to progress. First disposable glass syringes were there, the first glucose meters, and if you remember those, they were a huge device. We then had the first insulin pen around 1985. We had CGM, continuous glucose monitoring was launched in about 2014. And it's probably in the last, 15 to 20 years that we've seen these huge surges in terms of technology. And what does that mean? Let's move on to the next one. This technological revolution, as I was saying, things have become so much smaller. We've got to look at glucose sensors, which we now, as people pricking their finger, and like waving their mobile phone near this, and it gives you not just a single reading, but it also allows you to have this thing called time in range, which again gave people far more confidence around the day-to-day management of diabetes. And I think certainly as a healthcare professional, we see this technological revolution as being amazing. However, we also recognise that there are, I think, pitfalls in this as well, particularly if you're living with somebody and if you're thinking, well, the beeping noise, the alarm system, what happens, when everything else is quiet in the house and your alarm is still going off. So it's wonderful, but there are challenges, I think it's fair to say, and this is from listening to people with diabetes. Gail, I think this is where you probably take over, but let me just check the next slide. Yes, you're going to be talking about participant involvement.
Thanks very much, Bernie. Really interesting to see the history of diabetes research. And it's really important that the public get involved in diabetes research, because without that, we wouldn't get those discoveries. So I'm going to talk you through research, what research involves. And I'm going to also look at the difference between participant involvement and participant as a patient, because they're two different things. And I've also got my colleague on the line, Jeev Gunasekaran, who at the end can answer any questions that you might have around public involvement. And I would also recommend that you have a pen and paper or a phone, because we have got quite a few details of quite a few studies near the end of the presentation where we are looking for participants, and it would be great if you were able to take down the details. The slides will be sent, but there are QR codes and email addresses and all sorts of information that we can share with you. So it's really important that the public get involved in research, because your contribution can directly impact research and improve people's lives. And I just want to explain a little bit about the language that I'm going to be using today. So there's quite a few words that are used interchangeably. So the words research, study, trial, and clinical trial, I'm going to be using those words interchangeably quite a lot tonight. And also the words participant, patient, and volunteer are also going to be used interchangeably as well. And I'll probably flip from one to the other, but they all essentially mean the same thing until we come on to talk about the public and patient involvement, which is slightly different. So who can take part in research? We get asked that question, and the answer is everyone. There is always a lot of research going on in the NHS, and you don't always need to be affected by the condition that's being researched to get involved. And that's because we need other people to compare information with. So it might be that we do need people with diabetes, but we might also need people who don't have diabetes. Or we might need people who have no health conditions at all, or very minimal health conditions, and what might be called a healthy volunteer. But in many cases, you can take part in research if you have an unrelated health condition or no health condition. And so we undertake research in children, we undertake research in old people, in men, women, and people of all abilities, including people with learning disabilities as well. We have undertaken research into diabetes in learning disabled populations as well. So anybody can take part in research. There are lots of different types of research. You might be invited to participate in a survey, or there might be some observational research, which might mean somebody's looking at your medical records, or they're just taking blood tests over time. And then there are interventional research, where you might be actually testing a new treatment or a comparator or a placebo. So they're new words maybe to some of you. So a placebo is a dummy drug. And a comparator is normally when we're testing a new drug, a test drug, against an existing drug or an existing device. So there are lots of different types of research that you can get involved in. And there are lots of reasons why people get involved in research. This survey was undertaken in 2013, and nearly 6,000 people were asked all around the world why they wanted to take part in research. And the most popular response was that they wanted to advance medicine. Most people want to get involved to advance things. And the second reason was to help improve the lives of others. A lot of people want to get in research for altruistic purposes, which is fantastic. And we really couldn't do what we do without people and their altruism. 15% of people wanted to get involved to help improve their own condition. 5% of people wanted to earn extra money from participating in research, and I'm going to come on and talk about that a little bit more. And then 3% of respondents wanted to receive free medical care, and that really is reflective of the worldwide population. So we know that in some countries, especially America, you have to have insurance to get health treatment, and some people aren't insured, but by taking part in the clinical trial, they can receive treatment, whereas in the UK, you don't need to pay for medical care, so that doesn't apply. And we can't really talk about what research involves without talking about the safeguards that are there. It would be very wrong of me to come here and try and persuade people to get involved in research without explaining how we look after people. So research aims to answer questions and to provide new knowledge and understanding about various conditions. And this involves testing new approaches. They might be new treatments, they might be new medicines, they might be new diagnostic tests. And there is therefore a variable degree of risk for participants depending on the type of research. So to manage that risk and to keep people as safe as can be, the research in the UK is highly regulated in order to protect participants. And it's also really important to say that if you do take part in research, you can choose to leave a study at any time. You don't have to give a reason, and it doesn't affect the routine care that you receive. And I think that's a really important message. Even if you feel you've committed, but you can't continue to commit, that's absolutely fine for you to walk away. Some people will stop with a drug or a device or the intervention, but still stay in the study, so still have their data collected. But some people will withdraw completely and not be involved at all. And again, that's absolutely fine. That's not a problem. So there are a team of people who will look after you when you're involved in research, especially if it's a piece of research involving a test drug or a test device. And it's really important that you know that all staff that are involved in research must be trained in running research, and they have to be trained in something that's called good clinical practice. And that covers the rules and regulations about how to carry out and how to manage research studies. And their work must always have 3 aims, and that is to keep participants safe, to ensure the quality of the work and the data that's collected, and to respect the rights of the participants that take part. And this diagram that I've created is to represent the different people that can support research. So first of all, you have a research physician, usually that's designated the principal investigator. And the principal investigator has the responsibility for the overall conduct of a research study at that particular site. You'll then have people that support the principal investigator and that doctor, that physician, in delivering the study. So you'll have research nurses and research practitioners. And they're the people that really see the patients. They do a lot of the measurements, so things like blood pressure, height, weight, collecting blood samples, for instance. And they're the people that are generally the front line that you see when you take part in a research study, especially in a hospital like ours in the NHS. And they're the people that mainly collect the data from you. So they might ask you questions and they'll record that either on a paper form or in a computerized form. There are also some other people behind the scenes. So there's a pharmacist, which is denoted by somebody holding a bottle of pills. Pharmacists are really important to what we do. They dispense the medication. So the medication, if you're on a medical trial, is prescribed by the doctor, and then that's dispensed by the pharmacist. And we've got clinical trial pharmacy support in all of our hospitals and University Hospitals of Leicester. There's also other people behind the scenes that you won't necessarily see. So for instance, we have commercial trial project managers, or even for academic studies which are run with universities, we have trial managers that don't see the patients but make sure that the logistics all work swimmingly. We also have people like data managers behind the scenes who make sure that all the data is inputted accurately in a timely way and deal with any queries about that data, making sure that the question that the company, the sponsor, the university, whoever it might be, is trying to answer, they actually get all the data that they need to answer that question. So there's a whole team of people surrounding you if you take part in research. And so I said that there were regulations and approvals that need to go through, that researchers need to go through before research is approved in the NHS. And the simplest of the approval is this 3-step process. So first of all, a study needs to go through peer review, and that means that it gets reviewed by other researchers and other scientists to make sure that it's sound scientifically. It then needs to be reviewed by an ethics committee. And in the NHS, there are ethics committees that sit all over the country, in every region of the country, and they review applications. And I'll come on to the ethics committee in a little bit more detail. The final approval is approval by the HRA, which stands for the Health Research Authority. And they are essentially a government authority that will give the rubber stamp to a piece of research. And once you've got your HRA approval, then your research can go ahead. So research ethics committees are responsible for looking after a volunteer's rights, safety, dignity and well-being. And they also decide if a study can go ahead. They are able to say, no, we don't think that this is an ethical study and it shouldn't go ahead. What the research ethics committees do is they look at the potential benefits and make sure that those benefits to the people involved in a study are likely to outweigh the side effects and the risks of taking part in a study. They make sure that participant information is clear and satisfactory. So all the documentation that you might see, or any adverts, social media adverts, text messages, emails, anything that goes directly to a participant or a potential participant has to be reviewed by the ethics committee. They make sure that any expected side effects are clearly described, and they make sure that people are recruited for a study in an appropriate way. There are standard ways of recruiting people to studies, for example, by using advertising materials, by using social media, and by working with other healthcare professionals. So your doctor or your nurse, for instance, might ask you to get involved in research. They also make sure that the paperwork is comprehensive, but they also make sure that it's in lay language, and that means that it's not written for scientists, it's written for the general population. And they may suggest changes. They frequently do suggest changes to documentation before the committee can give a study the go-ahead. And researchers cannot change the protocol without telling the ethics committee. So every study has got a protocol, which is basically an instructional manual for a study. It explains precisely what's going to be done and how. And we can't change that protocol without the ethics committee approving that change. And the ethics committee can stop a trial at any time. So if they have any concerns about the welfare of people taking part, they can stop a study, and we are then legally obliged to stop that study. If your study is slightly more complex and you are working with medicines or device, there is an additional step, and you'll see that there's an additional box here, the pale yellow box, which is for MHRA approval. So the Medicine and Healthcare Products Regulatory Agency. And again, that's a government agency, and they have to approve every research study that involves a medicine or involves a device. So if, for instance, you've just got a questionnaire study or a study that's just taking blood tests, for instance, then you don't have to have MHRA approval. If you're looking at a medicine or a device, there's that additional step there that you need to go through. And if the MHRA don't approve a study, then the HRA will not approve a study. It has to go in that order. So how do we make new drug treatments safe? How do we make sure the studies are safe? What we do is we test drug products in a phased way, and they are called phases. And these different phases help establish what become a new medicine and what doesn't become a new medicine. First of all, before new medicines are given to people for the first time, all of them are checked for safety in cells and in animals, and that is a legal requirement. So before it even goes into a human being for the first time, it's checked in cells and animals. Then there are several different phases of clinical trials in people, and I'll take you through this diagram which explains the different trials. So a phase 1 trial is likely to last probably only a few months, and it usually involves only 20 to 100 healthy participants, and they're sometimes called healthy volunteers. So these are people who don't have the disease in which you want to study and you think your drug might be effective. These are just healthy people. And the purpose of that phase of a clinical trial, the phase 1 trial, is to look at drug safety, to look at drug side effects, and to look at the mechanism of action. So is that drug really working in the body how they thought it would work? And around 70% of drugs that are tested in phase 1 get through to the next phase, which is phase 2. And phase 2 studies last several months to around a year, perhaps a little bit longer. And what they're looking at there is up to several hundred people with the disease or the condition that they think the drug might be effective in. And what they're looking at there is drug safety, drug efficacy, and that means does the drug work in the condition that you think you're targeting? And what dose and what frequency of dosing do we think will work? So in phase 2 studies, we're looking at the patients that will ultimately receive the drug, but there might be different groups of patients. So some patients might receive different doses of a drug or different frequencies of a drug. Some might receive it once a day, some might receive it twice a day, for instance. And only around a third of drugs that are tested in phase 2 actually move through to the next phase. So there's quite a lot of attrition there. Phase 3 studies last many years. 1 to 4 is normal, but certainly some of the studies that we're working on can last over 5 years, maybe even up to 7 years. In diabetes, that's not uncommon. And for instance, if you're in cancer research, some of those studies can last many decades. In phase 3, what you're looking at is much larger numbers. You're looking at usually thousands of people with a condition. And what you're looking at there is drug safety, again, drug efficacy, and drug benefits and risks within that population. So you're looking again at things like how do the drugs interact with other drugs that they might be taking, for instance. And only around 25 to 30% of drugs that are tested in phase 3 actually get through to the next phase. And the next phase is regulatory review. It's at that stage that all the data in the UK will go to the MHRA, the Medicine and Healthcare Products Regulatory Agency, and they will then make a decision as to whether they're going to license that drug and give it a license. And when a drug is licensed, it means that it can then be prescribed in the UK by prescribers. Sometimes there will be phase 4 studies, and phase 4 studies are after your drug is licensed. But what they do is they usually look at long-term safety, and they're looking at real-world evidence. So they're looking at how that drug is used in real practice. So as it might be prescribed by your GP or hospital consultant, for instance, and how that drug works, not in necessarily a very strictly controlled trial environment, but more in the kind of open use in the normal NHS. What's really important about taking part in research is consent. And people who take part in research have to give their consent. And what that means is that you need to give your permission to take part in the research. And it's a legal requirement to seek your consent unless special permission has been given for the research to occur without consent. Occasionally, research can occur without consent, but that's usually in very particular circumstances. So, for instance, it might be that they're just looking at data, and sometimes that can be done without consent. And unless you've actually, there's a national opt-out that you can opt out of with your GP, and unless you have selected to opt out, your data can be used for research purposes. The other way that research can have special permission is if it's a very sensitive area. So for instance, research into suicide, research into stillbirth, for instance, they're the 2 areas where the families involved may not be asked for consent because that's too upsetting. Most studies will ask you to consent in writing, some studies verbally, but certainly if it's a treatment with a drug or a device, you'll be asked to provide consent in writing. And if you give your consent, your research journey can begin. It's really important when you take part in research to make sure that you've got all the answers that you need, and the research team are there to answer all your questions. And if you're uncomfortable with any aspect of a study, then it's really important that you ask those questions and speak to the research team. If you're under 16 years of age, you don't give consent, you give assent, which is giving permission rather than your consent. And someone with parental responsibility will provide consent on your behalf, taking into consideration what they think your views are, or would be, certainly if you're a very young child, for instance. However, even very young children are asked their opinion, they're explained in very simple terms. And if a child says that they don't want to take part, then the research team will respect that. We understand that not everyone feels comfortable taking part, and you should know that that's okay. It's your right not to consent. there are many other ways that you can support research without participating as a volunteer. So I wanted to go into a bit more detail about consent because it really is a key part of what we do. So to take part in a study, first of all, to consent, you must have all the information. So you'll be given a patient information leaflet that has been through the ethics committee. It will detail the risks and the benefits. And as I said, it should be written in plain English and you will be able to ask any questions. Second of all, what's really important is that you have capacity to consent, and the law assumes that an adult has capacity unless it's determined otherwise. So if a study team has any concern about your capacity, most studies, certainly in diabetes, will require you to have your own capacity. And if you don't, or there are concerns about that, then you won't be able to participate. To provide consent, you need to be able to understand the information that is shared with you. You need to remember the information and weigh up the pros and cons for you. You then need to be able to communicate that decision to the research team, and that decision will be respected and you will be supported at every step, but you do need to have capacity. So the law sets out how the research team can determine whether you have capacity if there are concerns. And there is a two-stage capacity assessment that can be used to help them decide. In some studies, certainly if you're looking at dementia studies, neurological diseases, for instance, it may be completely appropriate for you to take part, even though you lack capacity, and in which case there are legal safeguards in place to make sure that someone is looking after your rights and well-being. The final point about consent is it's voluntary. You must give consent voluntary, and it means that you choose to take part without feeling under pressure from anyone, including the research team, and including your GP, any nurses, for instance, that might be caring for you, or whether it's your family or friends. It has to be your decision. Sometimes we get people who come into a research study and they say, oh, well, you tell me what to do. You know, you advise me, you're the experts. We can't do that. We can give you the information, but you need to make your own choice as to whether it's right for you. So what happens during a study of a new drug or device? And it's fair to say it differs quite a lot from study to study, but you should expect regular tests and monitoring of any side effects. Regular tests will make sure that we can understand how your treatment is working. And this includes any side effects that you might be experiencing. So you'll be asked questions about any new symptoms on a regular basis. And this might not just be kind of physical health symptoms, but it might also be psychological symptoms or any physical health symptoms. And the type of tests and the frequency of tests will vary according to the research that you're taking part in. So be sure to ask what's involved before you commit. You might be asked to fill out questionnaires on a regular basis during a study, or to keep a diary. For instance, you might be asked to keep a diary of when you've administered a drug, taken a drug, or injected a drug. You might be asked to fill out a questionnaire about your food intake, for instance, or your physical activity intake. That's quite common in diabetes studies. It might also mean that you need to visit a hospital or a GP more often to undertake the research. So bear that in mind again before you agree to take part. So it's also important when you take part in research that you understand how your information will be used. So they will collect, the research team, quite a lot of information from you and from your blood tests or any scans or x-rays or whatever it might be. And you need to know that that information is always held securely and it's kept confidential in the same way as your medical records. And usually, certainly for most of the studies that we run in our centre, the person organising the research doesn't get to know your personal details. Everyone gets given an identification number, and that is how they know you, as that identification number. They don't know your name, your address, where you live. They'll only know sketchy details. They might not even know your full date of birth. They might just know the year that you were born. And in terms of confidentiality, what that means is that researchers cannot tell anyone that you're in the study without asking you first. Where there is a requirement to tell other people, you will normally be asked to do that at the consent process. So you'll sign a consent form, and it usually say on that form, I give permission to share my details with, and it might be, for instance, your GP. So your GP, your doctor, or your consultant, depending on who approached you about a research study, it can be helpful for them to be told, especially your GP, because they're responsible for your day-to-day healthcare. But again, they can only be told with your permission. If we feel that it's essential that the GP is told and you don't want them to be told, then that's not in your best interest, because it doesn't keep you safe. So we would therefore advise that you didn't take part in a study. Once the results are published, once the study has finished, the results are usually presented at a conference or in a journal, and no names or any information that can identify the participants is used. So it's all sort of aggregated data with summary statistics, or if it's a qualitative study, and that means where they're, for instance, maybe doing interviews with people, collecting people's thoughts and feelings or experiences about something, you're usually just described maybe by your gender and your age, or just participant 1, 2, 3, 4. The question we get asked a lot in research is, once a study finishes, can I stay on the treatment that might have been really successful for you? Unfortunately, that's not always possible. First of all, it might be a really long time before a new treatment is provided by the NHS, especially if it's only a phase 1 or a phase 2 study. Remember, the licensing happens only after phase 3. And sometimes new treatments are not made available on the NHS, or certainly not rapidly. So in this scenario, you'd be given the standard treatment for the condition that you have. You might be able to buy the new treatment on a private basis, for example, if the drug has a license but is not available on the NHS. And many of you might be aware that some of the weight loss drugs at the moment, so for instance, tirzepatide, most people who are having that drug, and that at the minute, I think there were 2.1 million prescriptions for that last month, private prescriptions. Most people are getting that on a private prescription because they don't meet the criteria for the NHS allocation of that drug. There are some studies where the people organising the trial may arrange for you to have access to the drug after it, because you've given your time and your, literally your bodily fluids to help the research. And sometimes you can be given access on compassionate grounds. That does happen. Certainly in oncology studies, that's quite common, whereby you will be given compassionate access to a drug. And how do we decide whether to make a treatment available on the NHS? So when a study starts, we don't know whether it will be made available on the NHS, because we don't know at that point whether it will work. And it's the National Institute for Health and Care Excellence, which you may have heard of, which is called NICE. They will recommend whether the NHS should buy new and existing treatments, depending on how well a treatment works. But also, it's not just about whether it works, it's about whether it represents value for money. So research is always needed to prove this, and sometimes treatment costs only become clear after a study is finished. You might realise that patients might need the drug, but they might also need some psychological support. They might need some specialist interventions alongside, for instance. So it's really important that that overall cost is taken into consideration, and it's NICE that make that decision. So practical considerations of taking part in research. The first consideration for a potential participant is the location of where that research takes place. Research is taking place in more and more places, and it's not just in hospitals and GPs. Research is taking place in mobile research units, for instance. More and more areas are now having mobile vans that are going around and recruiting. Quite often research studies are taking place in community venues such as community centres, church halls, schools, nurseries, council buildings, for instance. But you need to think about where the location is for a research study. Can you get there easily? And can you get there on a regular basis in conjunction with the information that's provided to you in the patient information sheet? You also then need to think about the commitment. So the number of visits that might be needed in your diary, and the time that it's going to take for each visit, which is what that clock and calendar represents. Some studies, it might just be a one-off 5-minute survey. For some studies, you might need to come back every 2 weeks, every month, every 6 months. And for most studies, especially with drugs, we find that the visits are more frequent to start with. Then when it's ascertained that you're getting on fine, then the visits might be less frequent. But you need to be able to make sure from the beginning that you can make those visits. Some research centres will allow patients to come really early in the morning. That can be really helpful, or just stay open late at night. I know we've got one participant on one of our studies at the moment who is a teacher and can come first thing in the morning, but they can't maybe stay for very long because they've got to be at the school gates at 9 o'clock in the morning, if not earlier. So what we do for that person is we split their visits. So a 2-hour visit might only last 1 hour one day and then another hour on a different day. So research centres will usually bend over backwards to be flexible. We really want people to take part in research. If necessary, some centres will also be open at the weekends. But have the conversation with the centre as to what they can accommodate and can't accommodate. What's also really important is to be really clear on the expenses that are provided. So some studies, especially if it's a commercially sponsored study, so that's a study that's funded and organised by a commercial company such as a pharmaceutical company or a device company or a biotech company, they will always provide money to the NHS to cover your travel expenses. So if you need to get a train, if you need to get a taxi, whatever it might be, petrol money, parking money, that is always covered, every single penny of it. Some studies will also give you inconvenience fees. Now, you can't actually be paid for a study in the UK, but you can receive inconvenience fees. And certainly for instance, a phase 1 study, which is usually really tightly controlled. On a phase 1 study, you're probably on a ward for probably at least a day. That takes up a lot of your time. And we know that people either need to take time off work, they need to maybe get childcare, dog care, they might be a carer for their mum, they might need a carer there. Whatever it might be, those costs will be covered. So usually the more complex study, the longer it takes, the more money you will get. However, not all studies will pay. Certainly studies that are more academic in nature, so run by the universities, you're less likely to receive certainly as generous payments for your time. But the general rule is ethics committees will expect you to be reimbursed at the minimum of the national minimum wage. So if you're working and need to take time off work and you don't get paid for that, you will at least recoup that. So they're the things that you need to consider: the location, the time commitment, and being mindful of the expenses and the support that's provided to you, because that can really help. Okay, I'm going to play you a video about a scheme called Be Part of Research, and it's about encouraging people to get involved in research. So I'll play you this video. Oh, is it working?
You need to just go back to the beginning, Gail. Yeah, drag it all the way back, yes. Then it's volume.
Across the UK, people like you are transforming health and social care. How? By being part of research. Research provides the knowledge we need to help us to live healthier for longer. involved in shaping research, what happens on a study, and find out what research studies are taking place near you. Be part of something amazing. Be part of research.
I'm just going to reshare my screen, bear with me. I'm not sure you heard all of that video, but hopefully you will have at least seen the subtitles. I'm going to talk about it in a little bit more detail, so don't worry if you didn't quite catch it all right. Let me sort my screen out. Can I just check, Bernie, that you can see my screen again?
Yes, thanks, Gail.
That's great, thank you.
I think we, trying to move away from, the research.
Excellent.
Yeah.
Thanks. So essentially what that video is saying is that they've got to be part of research service, the NIHR, and I'll come on and explain fully what the NIHR is. And the Be Part of Research service is a free service, and it makes it easy to find and take part in vital health and care research across the UK. You can search for Be Part of Research on the internet, and it also is available on your NHS app as well, if you have the NHS app. What happens is you go into the service and you simply tell them which health conditions you're interested in, and they'll match you to suitable studies and send you information by email about how to take part in studies. So the NIHR is the National Institute for Health and Care Research, and the NIHR is the country's largest funder of health and social care research. It gives organisations and researchers money, it gives us support and technology to do research. And the NIHR is funded directly by the government, and it's not a private company. The mission of the NIHR is to improve the health and wealth of the nation through research, and they directly fund much of the staff, much of the equipment, and many of the academic studies that we run at the Leicester Diabetes Centre. They're really important and crucial to what we do, and without the NIHR, research really wouldn't be anywhere near as vibrant as it is, in the UK. Many countries are very jealous of the NIHR and what they provide in this country. Another way that you can take part, specifically if you're local to Leicester, is you can join Leicester's research registry. So when the information comes out, you'll be able to click on a link, and there's also a QR code there that you can access the website with. And what happens when you sign up to that service is that you receive emails about taking part in clinical research at Leicester's hospitals. You're not signing up to take part in a specific study, and you get a regular email newsletter which will give you a variety of things that you could get involved in. What you're doing is that you're letting our research department know that you're happy for them to contact you, and if they think you might be interested in taking part in a study or a clinical trial, or helping them to design research with public input, and I'll come on and talk about that in a bit more detail. And you can use the research registry here at Leicester if you're over 18, if you have an email address, and if you live in the UK. And it literally takes about 5 minutes to just quickly go in and share your information. The other thing that you can do to support research is become a member of a research ethics committee. And you remember I was saying earlier that the part of the approval process for research is that a study has to be approved by a research ethics committee, sometimes called a REC. And the public can become members. If you go onto the HRA website and become a REC member in there, there is lots of information on there. They need people who have got healthcare employment experience and people who have no healthcare employment experience. They're very happy to have lay people. And as a REC member, you will attend monthly meetings online on Zoom, and you're asked to attend a minimum of 6 meetings a year. Meetings usually last about half a day and require 5 to 6 hours of reading to prepare in advance. And as a member, you'll need to be confident in reading, understanding and analysing complex issues and weighing up conflicting opinions, because you're going to have to make ethical decisions about research studies. You're going to have to take an objective stance and look at a situation from several perspectives, especially the patient perspective. And you're going to need to communicate with the group and voice your opinions. So they're looking for people who aren't backwards in coming forwards. And you'll need to be happy to work online and access and review documents online and attend meetings online. But you will receive a lot of support, a lot of training and a lot of mentoring to take part in a role like that, because it is really important role. And again, you do get expenses for that role. So that's a different way to get involved in research that isn't actually being a participant in research. The other thing that you can do is something called public and patient involvement, and that's different from participation. So that's not testing a new treatment. It's being a member of a team that work together to design and run a study or a trial. And what that means is that we then have the right people involved from the outset. We need people involved in designing studies that are affected by the research, and they have a right to have a say in it. And members of the public can provide a really different perspective and a different view from researchers, and it's really important that we hear that view. Involving members of the public can tailor research to the needs of specific communities, which is really helpful because we might only have a very narrow view. And public involvement can help make research more relevant, which is really important. I remember there was some research taking part in arthritis, and a researcher had designed a protocol, and they were doing lots of surveys and measurements about things, and the patient said, I just want to be able to open a jar of jam. And to them that was really important, and that wasn't being measured in the study, and to them that would tell them then that they had the dexterity that they needed and their condition was improving. So it's really important that the public are involved in those sorts of decisions as to what's measured and how it's measured. So here in Leicester, our Biomedical Research Centre that Bernie was talking about earlier has a really vibrant research community, and we've got a group of more than 300 members of the public that are involved in involvement opportunities. So they're contacted via a bi-weekly email on available involvement opportunities, and we have got a really diverse group of people from all sorts of various backgrounds. We have what are called PPI, so patient and public involvement focus group discussions. They happen in person or online. And we also have public research champions, which are our representatives in the community, and they support connections with seldom heard communities. So that might be, for instance, groups of patients from a particular minority group, for instance, and that would be a really helpful view to have. The other thing that we do is we host dance and health arts-based workshops. We have 3 venues across Leicester that hold dance and health workshops, and they have regular groups of various genders, ages and ethnicities, and they meet weekly for dance sessions with an instructor. And this is about us providing to the community a physical activity that helps people to stay fit and healthy. And what happens there is that a researcher joins the group and takes part in the dancing. I've done it myself. To build rapport with the group, and then after the session the group stays on with the researcher and discusses a particular topic that the researcher might need public input into. And the researcher can always return to the group later, a few months later, to get additional feedback or to provide feedback to the group as to how their input made a difference. The other thing we do is we work really closely with our local Afro-Caribbean community. We've got a group that meets every week in a church in Leicester that's got really strong links with the local Afro-Caribbean Centre. And we've also got a Nigerian breakfast cafe that's run in Northampton for younger people to get their input into research studies. And we also have a simple language panel, a public panel that reviews participant-facing documents and ensures the language is in lay terms. and that panel provides really quick turnaround for researchers. It's really important to say, though, that even if you're not based near Leicester, there will be a research centre near you that will do this sort of work, and this is the sort of public involvement work that research centres are always looking for people to take part in. So if you've got a research centre closer to you, please do get in touch with them, and they'll be able to link you up with their local groups. To take part in our Leicester research community, there's a QR code there to join the Biomedical Research Centre community. So you can scan that, or you can go to our website, which is leicesterbrc.nihr.ac.uk/get-involved. And there's more information there if you'd like some further information. Now I'm going to talk about the studies that we've got open to recruitment now. And this is quite a long list. So it gives you an idea of the sort of work, first of all, that we're doing at the Leicester IGBT Centre. It gives you... Now, because we're such a big and kind of disparate group, there are lots of different email addresses, which really isn't helpful. But the information about certainly most of our studies is also on our website, which is www.leicesterdiabetcentre.org.uk. And if you go on there, there's a section about research. But the first study I want to talk about is OPAL. And this is a study in people who are overweight. And you can be randomized to one of 5 treatments to compare combinations of weight loss therapies and exercise programs. We're looking for people who are aged 18 to 75. With a body mass index of greater than 30. And if you don't know your body mass index, if you just type in BMI calculator into an internet search engine, it will find it very quickly, and you can just put some information in and it will tell you your BMI. Or you can have a BMI between 27 and 30 with a risk factor such as type 2 diabetes or high blood pressure. And there's an email address there, opal@le.ac.uk, if you're interested in that study. We're conducting the Step Up to Sleep study. We're looking at people with type 2 diabetes who have poor sleep. And we're combining sleep-specific talking therapy, so CBT, cognitive behavioural therapy, with light intensity activity. And that's taking place in Leicester. And there is an email address there for you, which is ahac1@leicester.ac.uk. We're looking at a study called POET, and that actually doesn't particularly have anything to do with diabetes, although we are looking at HbA1c levels in people's blood, but we're also looking at lots of other things in people's blood. And what we're doing is we're looking at point of care testing, so testing at home versus a blood test, and seeing whether the values that we get are any different. And that is just a one-off visit to Leicester, and that's all that study involves. And that is a uhl-tr.poetresearch@nhs.net to email us for that one. We're running the ASSIST study. This is sponsored by a insulin pen manufacturer. It's for type 2 diabetes. It's running in Leicester, and the plan is to make that study UK-wide, so that you'll be able to take part wherever you live, including from at home. And the email address for that is uhl-tr.t1andtechresearch, that's t1andtechresearch@nhs.net. We're running the Domino study. That's to improve pregnancy care for people with type 1 diabetes and for those who have early onset type 2 diabetes, that's younger ages, who are less than 18 weeks pregnant with a single baby. And if you're in Leicester, Hertfordshire, Norwich, Ipswich, Salisbury, Hull, Nottingham, Northampton and Wishaw, you can take part. And it's uhl-tr.dominostudy@nhs.net if you're interested in that one. There's the PROTECT study. That's looking for people who are pregnant and have type 2 diabetes. And we're looking at whether continuous glucose monitoring is better than a finger prick test in terms of monitoring glucose whilst being pregnant. That is in Leicester, but it's also UK-wide, that study. And that is uhl-tr.diabetespregnancyresearch@nhs.net. So that's the first group of studies. I'll just leave those on for a moment so you can take any of that down. But as I said, also on our website if you are interested in any of those studies. So some of them are in Leicester, some of them will be, the ASSIST study, you'll definitely be able to take part in anywhere in the country. And the Domino study has numerous sites around the country. The Coyote study is an automated insulin delivery system for patients with type 2 diabetes, and that's taking place in Leicester, Addenbrooke's in Cambridge, Imperial College in London, Manchester Royal Infirmary, King's College Hospital in London, Guy's and St Thomas's in London, and Norfolk and Norwich University Hospital. And again, that's the type 1 and tech research team, T1 and tech research, if you want to contact them. We're taking part in the SOPHIST study, which is looking at the drug sotagliflozin and whether that improves the quality of life for type 1 diabetes patients who have heart failure symptoms. And that's taking part in Leicester, Ninewells in Dundee, Sheffield Teaching Hospitals, and again, that's the T1 and tech research. We're doing a study with Abbott, the device company, into ketosis. This is a really short and sweet 15-day study using a new continuous glucose monitor to monitor ketones as well as glucose levels. So they're measuring them at the same time in people who have got type 1 diabetes, type 2 or gestational diabetes, also in people with chronic kidney disease and heart failure. And that is at Leicester. It's at Imperial College in London, Norwich and Norfolk, Ninewells in Dundee, Derby and Burton Hospital, Calderdale and Huddersfield, Milton Keynes, Oxford University Hospitals, North West Anglia, Plymouth, Surrey and Sussex, Bradford, and at the Barts Hospital in London. And again, that's the T1 and Tech Research email address if you're particularly interested in that one. We do quite a lot of work with Abbott. Abbott make a lot of the sensors that are involved in continuous glucose monitoring, so there's always studies coming along from Abbott, and we've got a really good relationship with them. We are undertaking the CODEX study. So this is looking at the chronotype, which means a sleep pattern of people who have type 1 diabetes or type 2 diabetes, and how that impacts on their glycemic control. So there is some evidence already that whether you're an owl or a lark can have an impact on your glycemic control. This involves a one-off visit as a minimum, but there are also some other studies, sub-studies. So a sub-study is an optional part of a study which you can choose to take part in, which includes continuous glucose monitoring, and that's taking part in Leicester, Nottingham, Derby, Lincoln, Northampton, and Kettering. And if you want to take part in that, it's CODEX, at uhl-tr.nhs.uk. We're also taking part in the HEAL-D study, which is specifically for African and Caribbean communities. We're looking at healthy eating and active lifestyle in diabetes, and it's a culturally tailored self-management education and support programme. And that's taking part in London, Manchester and Leicester, and you need to be able to speak English and be an adult to take part in that study. And that is heal-d_study at leicester.ac.uk. We're also taking part in the MyFoot study, and that's looking for people who have got a previous or current diabetic foot ulcer in the last 5 years. We have got a really active team looking at foot ulcer prevention and foot ulcer treatment at the Leicester Diabetes Centre. And you'll be randomised to either standard care or to an educational or exercise programme. And that study has its own website, www.mifoot.org.uk. And that's taking place in Leicester, Derby, Sheffield, London, Glasgow, Salford, St Helens, Carshalton and in Epsom. And there's also an email address there, uhl-tr.mifoot@nhs.net, if you want to email the team as well. The other one, and this is what Bernie was talking about earlier, if you want to support research, you're over 18 and you live in the East Midlands, we're conducting a multi-ethnic lifestyle questionnaire study. There's a QR code there for that study. And it's a questionnaire study looking at how lifestyle behaviours could impact your health now and in the future. I've taken part in this study. I think most people in our department have taken part in this study. It's a questionnaire. You can either do it online or there is a paper booklet if you want to be sent the paper booklet. And again, there are contact details there if you want to contact the team and get some more information on that study. And then one of the final things we wanted to talk about is not a research study, but an offer. So this gives you an idea of the sort of thing that we develop in the Leicester Diabetes Centre, and this is called Steps for Health. It's a free online programme for anyone over 18 who wants to become more active, or anyone living with a long-term health condition such as obesity or diabetes. And it provides a personalised physical activity programme and ongoing support to help you improve your health by making you and supporting you to become more active. It's personalised and tailored to your fitness level and your mobility level. There's a walking program, for instance, which increases the number of steps gradually. There's online exercise sessions. There's a tracker that daily tracks your walking, your sitting, any workouts that you do, and your sleep. And it enables you to set daily activity goals. It enables you to have direct access to the physical activity experts within the Leicester Diabetes Centre. And there are competitions, challenges and awards to keep you motivated. And I know for some people, this sort of application can be really motivating. And there's lots of interactive content. And again, there's a QR code there in the bottom right-hand corner if that's something that you think you might be interested in. Or there is a website there. You can go and get some more information on our website. And again, that's the Leicester Diabetes Centre website. So I just wanted to close by summarising that there are lots of different ways to participate in a research study. You can sign up to be part of research for national opportunities. You can sign up to Leicester's research registry if you're local to Leicester. Look at our Diabetes Centre webpage and get in touch. And you can follow us on Facebook. So Research at Leicester's Hospital has a Facebook page and all our opportunities are posted on there. You can get involved in public and participant involvement by signing up to Leicester's BRC newsletter, which is again a local offer, or you can contact your local research centre, or you could join a research ethics committee via the HRA website, which is a national opportunity. If you want to get in touch with us after this presentation, please go to our website and there's a get in touch button and we'd be really happy to have any questions. And thank you very much for the opportunity to talk to you today. Thanks ever so much.
Hello, we're back.
You're back. We've done all the talking. Well, Gail's done all the talking. We're back, yes.
Yeah, fascinating. Thank you, Gail. It's amazing to see how much inspirational work's going on in the field of diabetes, all research. I think it's fair to say as well that a lot of the research work can't take place without funding, which is where the relationship between charities like ourselves and researchers comes into full play. Because as a diabetes charity, we have several aims. So awareness raising and education, our event program, but raising funds for diabetes research. And how much money have we given?
It's on our website.
It does change. It changes all the time. So yes, our website, we've got a whole research section there. And tomorrow I'll be sending out an email with details of this evening's webinar. And Gail and Bernie will send us links to everything they've just spoken about, and we'll pop that on an email, but we'll also pop that on our digital hub on our website, so you can view a recording of this webinar and access all of the links to everything, and we'll add on some additional resources as well. So I guess we've got some time for some questions. So I know Jeeves been sat patiently waiting for questions from the audience. Do we have any?
We've stunned everybody into silence tonight.
But it's such a lot of information to take in during an hour, isn't it? It's
Yes, there's one thing which I didn't really talk about in any great detail, and I can talk about it a tiny bit while we're waiting if there's any questions. And that was, I didn't really talk about things like placebo, particularly randomization and blinding, which are really important parts of research, especially in the drug and device research that we do in diabetes. So quite often medicines and certainly medicines will be tested against a placebo, and some patients aren't happy about that. They don't like that. But it's really important that we know accurately whether the effects, including the side effects, are statistically effective, or whether, if you just take water, people will get a headache or feel sick, or, so it's really important that we have a placebo. And certainly in a lot of the diabetes and obesity studies, we're now working more and more with sponsors and explaining to them that that's fine if you want people to commit and to potentially receive a placebo, but you should give them access to the actual drug at the end of the study. So we are working with them to make sure that that happens as much as it can. And also, you don't know whether you're going to get placebo or the active drug because you're randomized. And essentially, that's just like tossing a coin. The allocation of what you receive is random. And the only people that know are the pharmacist. So if the pharmacist even knows, because quite often it might just be a kit number and even the pharmacist might not know. But the people who are with you in the research team, we don't know what you're receiving. So that we can't be biased either when we're collecting any of the data from you. So that's really important. And that's what blinding is. So it's really important that you don't know what you're getting and we don't know what you're getting either. That's called a double blind. You can have single blind studies where that's more common in things like, for instance, surgery, for instance, perhaps. And I know of a neurological study where people had brain surgery. And some people didn't have brain surgery, but everyone had to go into their neurological assessment with the sort of disposable hats that you get in surgery. So the person that was doing the neurological assessment didn't know whether somebody who had brain surgery or not had brain surgery, and the patients weren't allowed to tell them. So that's a single blind where the patient knew and the healthcare professional didn't know. So, but there are lots of ways that we can make sure that studies are as unbiased as possible and make sure that they're really scientifically rigorous.
Yeah, it's interesting. Are there any cultural barriers to research? Because I know that we've talked about engagement with communities before, and are there some communities that are more likely to get involved or not get involved?
Yes, and most of that is due to practical reasons. So we collect data, quality data on the people who take part in research in our centre. And most of the people that take part, probably won't surprise you to know, although this is reflective of the diabetes population as well, to be fair, are middle-aged white women.
Okay.
And especially in that sort of retired age group. And we work really hard to make sure that the people that take part in our studies represent really diverse communities. And to be fair to the regulators globally now are wanting much more representation in their studies. So they're now coming to sites like us and saying, look, you've got a fantastic ethnically diverse population. We need data about our drugs in an ethnically diverse population. Please, can you collect data specifically in that population, focus on that population? So that's fantastic. We're getting more of that. But people like young working women are underrepresented, especially in research. They're working. They've probably got children. They've got childcare responsibilities. It can be really hard for that sort of person to take part in research. And there are some communities, especially communities that maybe don't have English as a first language, that is very tricky. And we work really hard to try and make sure that everybody can take part. In some ways, the digitization of research has helped to reduce those barriers and help with literacy and things. But in other ways, it makes things harder. Sometimes you're expected to have a mobile phone, you're expected to have internet, you're expected to have data allowance, you're expected to fill in a questionnaire that might be in English. So we are very much pushing back on those sorts of things to make sure that sponsors don't assume that everybody has got the same thing. So even where they do expect people to use a phone, for instance, to fill in a diary, we will always say, well, you need to provide a small number of mobile phones, because not everybody has their own mobile phone or has access to their data, for instance, because data can be expensive for some people. So we're trying really hard to knock down those barriers.
Yeah, it's easy, isn't it, to let technology overrun things like this. I think it's quite nice. Looking at your website, Leicester in particular, it's very user friendly. As a person with type 1 diabetes, I think sometimes you hear the word research study, and it can be quite scary because you think, well, I'd like to take part, but oh my gosh, what are they going to do to me? So it's nice to see it explained in sort of layman's terms, and to see that actually it is easy to take part. And Sarah and I were just saying, weren't we, while we were listening, that we've both taken part in research, and it is, as you said, it's advancing medicine, but also it's helping us, and it's going to help other people. It's just so important.
Yeah, and there are lots of new things coming around the corner, so things like the hybrid closed loops and things, there are always updates and new algorithms and new ways of working out how much insulin they need to give. All those things need to be tested. So we're always looking for participants. And certainly I would say the biggest growth area that we've had recently is in obesity research. We have got obesity studies in diabetes coming out of our ears, if I'm quite honest. So if you are a little bit overweight and you have diabetes, please contact us or your nearest research centre, because there are a lot of studies coming through in the next, I would say, well, with some certainly beginning of the year, beginning of next year, and there are more and more and more. It's a massive area now. And they're certainly the sorts of studies where we're trying to persuade companies that if someone's on placebo at the end of the study, please give them access to the drug, because it's life-changing for them. It really is.
Of course. Yeah, and people shouldn't be put off, should they? Obviously you're Leicester and your region, but from what you were saying, that the studies are taking part all over the country. So even if people got in touch with you about one of them, you might be able to signpost them to research in their own area.
Absolutely, we can, yeah. So where we're taking part in a study, we know the other sites that are taking part, and we can send you on. Or most studies are using the Be Part of Research service, so you can sign up to that and you'll be sent information. Usually that information only goes out once, though, so it might be that if a study's already opened, you might have missed that opportunity, if that makes sense, because they don't want to overwhelm people. They don't want spam your mailbox and you then unsubscribe. That's not what they're about at all. It's got to be sensible how many times they contact you. So
absolutely. And we get approached by researchers and young researchers all the time, don't we, to ask for help recruiting.
Yeah, I mean, not necessarily research that we funded, but we get young researchers asked for participation in their projects, and we're more than happy to put something on our social media or on our news channels, providing it's got all the right tick boxes. It's got ethics approval, and it's a recognised institute, and we're happy to help them. And I'd like to think that they get good feedback from that. So we like to help where we can.
Definitely. Yeah. So I think it's a multi-agency approach as well, isn't it? So the researchers, the institutions, charities, and like I said, when it comes to recruiting people to take part, social groups, social media, it's a it's a widespread approach, isn't it, to recruiting people and letting people know that the research is taking place.
We never just use one recruitment strategy. So our recruitment strategies are always multiple layers in order to get the most, first of all, diverse group of participants and to recruit quickly to studies, because we want people to be recruited quickly so we can get the information and move on to the next thing.
Yeah.
Definitely. Well, I don't know if we've got any questions. Everyone's been, like you said, stunned into silence.
Do we know of any research around sport? There's definitely research going on in our unit around physical activity and diabetes. Yes, definitely. So I would definitely get in touch. We have got a lot of links up with the sports science department at Loughborough University. And yeah, our biomedical research centre, which is looking at physical activity, is definitely looking at sports. Yeah.
Yeah. Have we got any researchers involved in sport?
Not at the moment, not that we've funded at the moment, no.
No.
We have done in the past, but not at the moment.
I saw somebody raise their hand. I don't know.
Yeah, I just saw that as well.
I don't know if they're able to just type something in. Any research in early type 1 LADA? There has been. Jeeve was talking to me this morning about LADA. Jeeve, what were you saying about LADA? You might need to type it in. I don't know if you can talk or not. Again, I would say get in touch with us and then we can always
Right.
and let you know. I'll be honest, there isn't a huge amount of research into LADA. The focus is much more on type 2, type 1 gestational. But do get in touch with us. And the other thing to do is to, I don't know if it's specifically listed on Be Part of Research. I've got a feeling it's not.
I think the NIHR website, if you can be quite specific about what type of research you're looking for or to be part of. So that might be an option to look on there. It's quite a good, easy website to follow, actually.
Yeah.
And it also allows you the opportunity of thinking these are the kind of areas that really could do with research.
Yeah.
It allows you to do that one as well. Have we got any other? I think that was it.
I just looked on the HRA website and we did have a study into LADA. It's an old one, but it definitely is something that we have done research in and are likely to do research in the future.
And Jeeves just answered to say we're going to propose a research centre in Northampton to deal with LADA and MODY.
Oh, great.
Wonderful. I get that's such a small percentage of the diabetes population, isn't it?
It's still important.
Yeah, most years at our events, we do get people that come along with LADA and MODY. So, but yeah, yes, Bernie, yes, so important.
Okay.
Yeah, so do get in touch and we'll link you into the right people.
Okay.
Any other questions from our audience? Are they all ready for their cocoa?
They're all ready for cocoa, I think, at this point. Yes.
Yeah, misdiagnosed. Yes, it does get misdiagnosed. Yeah.
Yes.
Yeah.
One of our research fellows, Shivani, Dr. Shivani Misra, she did a lot of research into misdiagnosis, didn't she?
My diabetes study and that.
Yeah.
There's a lot of information on our website about the work that she's done. So
yes,
have a look.
Yeah, we'll send the link. All of our funded researchers and previous funded researchers are on there, and you can see details of their work and how much they were awarded. So, well, if we have no more questions, shall we say good night?
Thanks ever so much for the opportunity. I really appreciate it.
Yes. Thank you, Lee.
Lovely.
Thank you.
Thank you, Sarah, and to the RWF.
Thank you. Yes, that was really interesting. And I think again, a big thank you to our sponsors, Dexcom and Bector and Insulet, who have very kindly sponsored our event program this year. I'll put links to some of their resources as well on the email when I send it out.
Thank you so much.
Okay, thank you, Bernie.
Thank
Thank you,
Thank
Gail.
you.
Okay, cheers. Goodbye.
See you
Thank
soon.
you.
Bye.
Bye.
Bye, everyone.